Podcast 18, Week 20. Welcome to the podcast, Your Pregnancy Week by Week. This podcast covers the 40 weeks of pregnancy in 38 segments and is based on the book Your Pregnancy Week by Week by Dr. Glade Curtis, MD, and me, Judith Schuler, MS. The information in our books and podcasts is a general informative guide about pregnancy. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctor. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your pregnancy concerns, questions, or interests into words. The goal of every pregnancy is a healthy mom and a healthy baby. To that end, our podcasts cover many topics. In each weekly podcast, we'll highlight information contained in the same weekly discussion in our book. We suggest you read each weekly chapter to learn further information, such as how baby is growing and changing, and how you're growing and changing too. Our book also contains illustrations of changes in baby or you, advice for dads, charts, lists, boxes, an exercise for every week, a comprehensive glossary, hints, tips, snippets, and blurbs we just can't reproduce in a podcast. So let's get started on this week's discussion. We're going to look at week 20. Congratulations! 20 weeks marks the midpoint in your pregnancy. You're halfway there. It won't be long now until you get to meet your baby. You may wonder why your doctor measures your tummy with a tape measure or finger spread at every visit. It's to help keep track of baby's growth. Within limits, changing measurements in you are a sign of baby's well-being and growth. If they aren't normal, it can be a warning sign. After this point in pregnancy, you should grow almost 1/2 inch each week. Cordocentesis, also called percutaneous umbilical cord blood sampling, or PUBS, is a test done while baby is inside your uterus. It's usually done after week 18. The test is done when a diagnosis can't be made from other testing methods. To perform the test, your doctor takes a sample of fetal blood from the umbilical cord, and results are available in a few days. Cordocentesis can also be used to deliver blood and medication to baby through the umbilical cord. The procedure can help prevent anemia if an Rh-negative mom has antibodies that are destroying baby's blood. The fetus can receive blood or blood can be exchanged. If you have a condition during pregnancy that causes severe pain, such as a root canal or a severe sprain, ask your doctor about using analgesic codeine. It's considered safe during the first and second trimesters. You have muscles from your lower ribs down to your pelvis that may separate in the middle as baby grows and muscles get pushed apart. You may notice the separation when you lie down. It kind of looks like a bulge in the middle of your tummy. You may be able to feel baby moving here more easily. The separation isn't painful and doesn't harm you or baby. If this is your first baby, you may not notice the separation. However, with each pregnancy, separation may be more noticeable. After pregnancy, these muscles tighten up and the gap closes. The separation won't be as noticeable, but it may still be there. Rheumatoid arthritis is an autoimmune disease that can affect pregnant women. Symptoms include joint pain, tenderness, swelling, and stiffness. Many over-the-counter and prescription medicines are used to treat RA. Ask your RA doctor and your pregnancy doctor about which meds are safest for you. Prednisone is usually acceptable. Methotrexate should never be used because it may cause miscarriage and birth defects. RA may not affect your labor and delivery. However, it may be harder to find comfortable labor positions if you have joint restrictions. Symptoms of your RA may return a few months after baby's birth. See your rheumatologist within 4 weeks of having baby. If you breastfeed, discuss the choice of medications with your RA and pregnancy doctors. Pregnancy is definitely sexy, and you may be sexier than you think. We know many men think their pregnant partner is more beautiful and sexier than ever before, especially during this middle part of pregnancy. Enjoy it. Has this led you and your partner to think about sex? For most couples with a low-risk, normal pregnancy, sex is something you can probably continue. If your doctor doesn't have any restrictions, enjoy yourselves. If you have any pregnancy problems or complications, talk with your doctor before continuing to have sex, and always follow his or her advice. We've been asked questions about using saunas, hot tubs, and spas during pregnancy. We suggest you avoid them. Baby relies on you for body temperature. If yours gets too high and stays there for a while, it might hurt baby. As for electric blankets and electric warming pads, we don't know of any acceptable level of exposure, so avoid them too. Use a down comforter or wool blanket to stay warm, or snuggle with your partner. Do you have body piercings or tattoos? The most common form of piercing is pierced earlobes. Your doctor won't be concerned about that. However, you may have piercings on other places on your body, and some of these piercings may cause your doctor concern. With any piercing, there's a possibility of scar tissue formation. Nipple piercing can damage milk ducts, which could interfere with breastfeeding. Navel jewelry could lead to ripping or tearing as you get bigger. With oral piercings, your doctor may talk about removing them before delivery. The anesthesiologist who tends to you may be concerned about keeping your airway open if jewelry is not removed. Because no one can predict what will happen during labor and delivery, it may be safer to remove jewelry as you get closer to your due date. Like body piercing, many people have tattoos. Don't be surprised to see a change in your tattoo if it's located in an area affected by pregnancy. That cute little butterfly on your abdomen may grow very large during pregnancy. In addition, stretch marks may run through it. After pregnancy, skin may remain stretched, and that cute little butterfly droops and sags until skin returns to normal after pregnancy, which may not be like normal before pregnancy. Be prepared. There's not much you can do about these changes. Tattoo removal during pregnancy is not recommended. Neither is getting a new tattoo. Wait until after baby's birth to remove or receive a tattoo. There have been rumors that if a woman has a tattoo on her lower back, she can't have an epidural or spinal anesthesia. Not true. If you're concerned, talk to your doctor about it. Many women use sweeteners. Caloric sweeteners include processed and unprocessed sugars. They add empty calories to your meal plan. Artificial or non-caloric sweeteners help a woman cut calories. Research indicates artificial sweeteners may be safe to use occasionally in small amounts, but avoid them if you can. Always read labels. Eliminate any substance you don't need from the foods and beverages you eat and drink for the good of your baby. Remember, our podcasts give you the highlights of what may be happening in any given week. Check our book, Your Pregnancy Week by Week, for more detailed information. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. It covers pregnancy from a man's point of view and provides lots of valuable information a man may find very useful. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. It details topics covered in each podcast, so you can listen to a particular podcast or read a certain chapter week if you want more information, or if you want to check out something you missed or a topic we haven't covered yet.